step is to identify a need that you are addressing with your vital signs monitoring program. For example, it could be something like a lot of patients after surgery are coming back for readmission. Untoward events are happening at home after discharge in patients from a critical care unit or from the cardiac department. This could be one need that you need to address. The second could be to add a new revenues, and third could be if you want to reduce the workload of the nurses, or you want to project an image for the hospital that this is a high tech, or fifth, this is something which you want to implement in the hospital so that the perception of the patient regarding the technology and the patient care improve. So once you have made clear the purpose of the program, it'll be easy to form the team. So that is the second step, which is forming the team. So once you've identified what is the need for starting a wearable continuous vital signs monitoring program, the stakeholders should be identified, and that falls into main three categories. One is from the administration and leadership. Somebody from the administration side has to take the leadership to study the problem and take the leadership to get it implemented. Second is to identify the staff required for this program. And third is to identify what is a category of patients, whether it is for a continuous vital signs monitoring in the hospital. What is the category of patients? Is it the category of patients in the intensive care unit, or a definite subset of patients like post-cardiothoracic surgery patients or coronary bypass surgery patients? What is a subset of patients you want to monitor with? Now, the next step is set your goals. What does success look like for your program? Or after implementing this and looking back after some time, how do you say that this is a successful program? So naturally, if you have identified the need very clearly in the beginning, that will help to narrow down the goals you set. These goals should focus on impacting your practice and patients. Definitely, it should lead to improvement in the patient care. There should be metrics by which the quality of healthcare has been improved by implementing this. So there are 4 areas of value one should consider when you define that a project is successful. The first is health outcomes. So there should be a definite change in the health outcome of patients who undergo this monitoring. Second is patient experience and engagement. Whether the patients feel that they are being looked after better, they become an e-patient. E-patient means an empowered patient. So they are, or an engaged patient. They feel that they are engaged in their own care. And third is regarding financial reimbursements. There are 2 things that should be looked into: whether these are eligible for financial reimbursement by insurance agencies, and whether the institution benefits financially by implementing this. Maybe by cutting down costs on one side, or second by adding a revenue on the other side. And the fourth is provider satisfaction. That means the people who are involved in implementing this, especially the doctors, the nurses and the hospital, feels that this is definitely an exercise which is worth it and it is providing satisfaction, it improves the patient care. Now the third step is to identify a wearable device company or manufacturer. So this will take some time because this technology is evolving day by day. Right from wearable technologies which can monitor many vital signs like oxygen saturation, the cardiac rhythm, the respiratory rate, the body temperature, the physiological status, whether the patient is standing, walking or lying, to identify whether he has fallen down, and lastly the blood pressure. So this technology is evolving. For example, in an Apple Watch, everything except blood pressure can be recorded. And there are devices which are available now where glucose can be monitored continuously. This is something that is evolving every year. And this evolution of technology might happen for the next 1 or 2 years. One has to decide whether you want to buy this or lease this. The advantage of leasing is definitely if new technology comes, you can go to the next technology so that whatever you have with you can be replaced by the new technology devices. But naturally, leasing becomes more expensive when you compare with buying. The problem with buying is naturally when you buy a device, next year it's going to be obsolete for sure. The fourth step is to identify and recruit eligible patients. So this one should do with care. First of all, in the initial step, we have identified what is the need for that. For example, if you are going to recruit only patients in the immediate post-intensive care, or patients who need monitoring immediately after surgery or after a head injury or in the emergency, one should identify that group of patients and they should be recruited into undergoing a continuous monitoring. Step 5 is to train patients and clinicians. So the problem with this wearable technology is one thing, it is device dependent. So if the device is not functioning properly, naturally the data that is generated can create problems. It may not be correct. And the clinicians also should be trained to how to monitor this. Here comes the problem. When you generate a data from a patient for whom this is not indicated, a lot of unnecessary data is being generated. Second, any fault of the device can produce false alarms. So this is what is called false alarm fatigue or false alarm overload. So it becomes mandatory that somebody has to address these false alarms and take action based on that. So when you generate a data for a subset of patients where it is not indicated, then it becomes a problem. And second, and the next step is the care coordination software to help you manage the continuous vital signs monitoring. Technology wise, it might be easy to generate data, continuous data. But the problem is what we do with the data. How are we going to monitor the data? Is the data going to be remotely monitored by some other office? What is the security of this data? Is it going to be a domain which is not secure because it's the healthcare data? And what is the professionalism of the people who are looking into this data? In an ideal scenario, the monitoring data should be reviewed in a hospital command center, which is becoming popular where it's like NASA space station control room where a lot of people sit, but more importantly, a lot of monitors show all these, and artificial intelligence and machine learning algorithms will read this and give alarms accordingly. So this is monitored in person by people who are qualified to do that, and actions are taken appropriately. So this is one of the crucial steps on what you do with the data and what is the software to be used, what is the technology to be used, and what is the manpower, and what is a location where this is going to be monitored. So one has to essentially understand the core nature of vital signs monitoring, whether first it is a continuous vital signs monitoring for patients admitted in a hospital, which might be beneficial in a very select subset of patients, like who are in the intensive care, who are immediately in the post of care, who need continuous monitoring. But whether it can be a substitute for the intermittent vital signs monitoring for all the admitted patients in the common wards, like for example, there's a patient admitted for fever or just a routine evaluation, need a continuous vital signs monitoring in the ward. This will generate quite a lot of data which is unwarranted. It will lead to a lot of false alarms, and the chance of picking up something is not financially viable, or it is not feasible to somebody to go through this large amount of data and monitor large number of patients. And second, if it's a remote monitoring, then one has to identify which are the subset of patients that needs to be monitored. Patients who are sent back from hospital after surgery. But naturally the problem is somebody has to monitor whether the wearables are used properly, because if any lead comes off, then naturally it will raise a false alarm. Now when you compare this with intermittent vital signs monitoring, which is the practice which is happening in most of the hospitals, where nurses go intermittently like 4 hours to the patient's room, check the vitals manually. So this lead has its own benefits and demerits. The benefits naturally are the nurse compulsorily will go and visit the patient every 4 hours. This, in addition to the vital signs checking, this will lead to an interaction between the patient as well as the nurse, and as well as if there is any other concern that needs to be addressed or discussed, that will happen during this vital signs monitoring. It will help to establish a rapport between the patient and the nurse. Thirdly, most of the patients are worried and they want to know about their vital signs status, whether it is within the normal range or with this above normal, which is can be, if it is in the normal range, it can be quite reassuring. And lastly, there is an escalation with what happens immediately, because when the blood pressure or some vital signs is elevated, immediately that needs to be escalated, and the nurse will have to find a solution to the problem. Now, the merits of having a continuous vital signs monitoring is naturally the nurse need not go frequently into the room. It can be monitored. There is a feeling of patient is being monitored continuously. Many times that can lead to a false sense of assurance that everything is perfectly fine. So that is why having a command center to very accurately monitor the data, go through the false alarms and address the correct alarms, then only this wearable continuous monitoring technology, whether it is for a continuous inpatient monitoring in the hospital setting or for a remote monitoring in a care home or from a residence or from the patient's home, becomes useful for in the clinical practice. Thank you. Please do subscribe to this channel and also let know your comments and thoughts about this. We'll continue with further discussion on interesting topics in the healthcare futurist. Thank you.